Welcome, everyone. Thank you so much for joining us today. I'm going to be your host of today's panel. I'm Brian Kelly. You might also know me as the Points Guy, and I'm a fellow Delta Platinum Medallion. The COVID-19 crisis has upended pretty much every aspect of our lives, whether it's how we work, how we educate our children, and most certainly, how we travel. Now, my personal COVID story is a pretty interesting one. Back in March, when things started to spread across the U.S., my business, which is all about travel, was pretty much turned upside down overnight as the aviation industry started to shut down and the virus spread. I myself actually contracted COVID in early March, and thankfully I was recovered quickly and asymptomatically. But there was a very long period of time where I didn't know when I would travel again. And there was a good portion of time I didn't think it would be in 2020 at all. Well, luckily, I did start to get out there earlier this summer, and I realized that the travel experience, while it's changed greatly, uh, has really adapted and innovated in these challenging times. I've been fortunate enough to fly a lot of different airlines, but I have to say, Delta, the experience has been truly top notch. And today we're going to talk all about how Delta has innovated during these times, not just coming up with new standards for their customers, but also employees, and bringing together some of the greatest medical minds in the world, as well as their private industry partners to help create solutions to keep us all safe. Today is going to be an interactive panel. If you're watching right now, please submit questions, and we're going to reserve about the last 20 minutes of today to answer any of the pressing questions you might have. Let's get straight into it. Let me introduce our panel today. First up, Bill Lynch of Delta. Let us know what your title is, what that actually means that you do, and your favorite travel destination.
Well, Brian, it's good to be here with you today, along with my fellow panelists, including Sandy Gordon here in the room with me from Delta. And my responsibility for Delta is I'm the Chief Customer Experience Officer. So in that role, I have airport in-flight experience, reservations. I have the brand design, consumer insights. I also have responsibility for operations and customer center. And my favorite destination, I'm a guy from Minnesota, and you'd think I'd want to go somewhere warm, but my favorite destination is Reykjavik, Iceland.
I love Iceland. Have you been able to see the Northern Lights there?
I've seen the Northern Lights, been to the Blue Lagoon. I've done some horseback riding out on the lava fields. Just so many unique experiences, which is why I love it up there.
Couldn't agree more. Great. Thanks for joining us today. And you mentioned Sandy Gordon. She's a longtime Delta exec and just an overall fabulous person. Sandy, thanks so much for joining us today.
Thanks, Brian, and it's wonderful to be here with the panel today. I am the Senior Vice President of Airport Operations for our West operations, and I have in that role the pleasure of working alongside the men and women of our airport customer service team who are entrusted with ensuring that the Delta customers' travel experience through our airports is safe, it's clean, it's reliable, it's welcoming, and it's warm, and they do a phenomenal job. And for my favorite travel destination, the beauty of working for Delta is I get to go anywhere, and so all the places are wonderful. But mostly right now, I feel it's Hawaii, and probably like many of our customers, that's because I'm so excited to see it open where you can travel and not have to spend 14 days quarantining when you get there. So looking forward to that.
Yeah, I've got Hawaii on my mind as well. And Sandy, just want to say congratulations on the opening of the new terminal at Salt Lake City. What a stunning facility.
It's beautiful, isn't it? I encourage anyone who has an opportunity to go there to see it. It's state of the art.
Great. All right, our next special guest is Dr. Henry Ting from the Mayo Clinic. Thanks for joining us today.
It's a pleasure to be here, Brian. Thank you so much. So I'm Henry Ting. I'm a cardiologist at the Mayo Clinic. My role there is I'm the Chief Value Officer, and in my role, I oversee quality, safety, customer experience, and our affordability initiatives. I'm here to represent our Mayo Clinic and Delta Airlines Advisory Council. And I guess my favorite place is I'm probably with Sandy here. I would love to travel anywhere where I don't have to quarantine for 14 days.
Yeah, we've got not too many choices these days, but slowly but surely places are opening up. And hopefully we get a lot more options in 2021. All right, next up is Dr. Carlos Del Rio from Emory School of Medicine.
Hello, Brian. It's a pleasure to be with you. My name is Carlos Del Rio, and I'm a professor of medicine, epidemiology, and global health at Emory University here in Atlanta. And I'm part of the group partnering with Delta to try to, as an infectious disease specialist, to try to get them over COVID-19. And I have a lot of favorite travel destinations. I do close to 100,000 miles a year, but Paris, without doubt, is my favorite one.
Paris is so beautiful. I'm going as soon as it opens up. All right, next up, Joe Rubino, who is from RB, the makers of Lysol.
Hi, Brian. Really great to be here with the panel today with Delta. I'm an R&D director in research and development. I'm a microbiologist. That's my background and training. I've been working with Lysol for well over 30 years and studying the effectiveness of our products killing and activating pathogenic microorganisms, including COVID-19 virus.
Hey, Joe, where's your favorite place to travel?
Oh, my favorite place to travel is Arizona. I go there once, twice a year, and there's a lot of social distancing in the desert these days.
It's a great point. I'm a fan of international travel, but there's so many incredible places in the U.S. to go. So Arizona is definitely one of them. Thanks for joining us today. And finally, we've got Dr. Jim Arbogast from Gojo, the makers of Purell.
Hi, Brian. Hi, everyone. I'm Jim Arbogast. I'm a scientist with Gojo. Been with Gojo for about 20 years. I lead our hygiene sciences and public health advancements efforts. And I'm excited today to talk about Purell innovation and the best practices for hand hygiene. I've been part of the World Health Organization private for patient safety, so I'm going to go with Geneva, Switzerland as my favorite destination.
Geneva is beautiful, and boy, is she expensive. It's beautiful, but safe. Use your frequent flyer miles to go there so you can use your cash on everything there. Thank you so much to the panel. Let's just get straight into the questions. And Bill, as the chief, customer experience officer, I can't even imagine how much your role has changed this year. And Delta, historically has been known as, the top notch when it comes to the experience. Clean cabins, in-flight entertainment, and friendly service. For those watching right now and who haven't flown yet, how can you describe the Delta customer experience today versus pre-COVID?
Well, there's no doubt over the last 7 months, 8 months, we have really had to change the delivery, the service, the experience in the airport, given the challenges of COVID. But I continue to fly every week. I live in Minneapolis, but I work in Atlanta. Continue to fly every week. And I know I'm biased with this answer, but the experience of flying has really never been better. If you're comfortable wearing a mask, the experience of flying, getting through the airports, getting on board, having space, it is a very simple, very enjoyable experience. But you will see customers and employees wearing masks. You will see social distancing markers throughout the airports, on our jet bridges, onto the aircraft. You will see all sorts of cleaning activities going on. We have looked at every bit of the experience, from the curb onto the airplane to bag claim and back to the curb, to understand what it is that we can do to ensure our customers have complete confidence that we have their well-being in our mind and we are taking care of it, which is why we partnered with all these great partners that we have here on the panel. So the experience is really an exceptional experience in my mind, and our customers are telling that with our NPS scores. Sandy will probably get into that. But the feedback that we're getting on what we have done to adjust the experience has been tremendous.
I was worried that the entire comfort, the joy of travel would be stripped away with all of these new safety procedures, right? And, flying Delta, it's actually incredible. Delta is one of the few airlines that is blocking middle seats, at least through early 2021. Can you walk us through a little bit of the thought process? Was that a really hard sell to revenue management to say, let's, really create a ton of space? Even 50% of a lot of the first class cabins are blocked. What was the thought process there?
Well, it was really simple. No, there was no selling to revenue management, because it's part of our values that at a time like this, in a crisis like this, in fact, at any time, It's people before profits. It's the safety and well-being of our customers and our employees before profits. Our approach has been to take a long one. We aren't about chasing every bit of revenue that we can right now. It really is about ensuring that our customers are completely confident in the way that we are going to care for them through the airport and on board the aircraft. So blocking the middle seat, that decision, that was not a hard decision for us because it was made in the mind frame of we're going to take care of our customers and give them confidence. At some point we will unblock, but we're going to make sure that our customers are comfortable with how we approach that going forward. So no, not a hard sell at all. In fact, our CEO, Ed Bastian, from the very beginning, this was one thing on our mind: people before profits.
Well, I can certainly say from a long-term perspective, I think we'll appreciate that, even though if it costs you a little bit right now. All right, Andy, let's talk about, you live and breathe the airport experience. Can you talk to us about how you've reinvented the airport experience for the Delta Flyer?
Yes, I'm sure for many of you watching today, it's been some time since you've been at an airport, let alone stepped onto an airplane. And I can remember the first time I traveled after the pandemic hit with my family. And it was the end of June, and that's after many months of working with the Delta team to put into place many pieces of protocol that would help us ensure that customers could feel comfortable and safe when traveling. But even for me going into the airport, there was a little bit of apprehension traveling with my family. And I have to say that experience was reassuring in so many ways. For me, it was reassuring to see all the things that we had discussed in life, to see them come to life, be it our team members out and being visible and present and assisting customers as they were coming in, wiping down surfaces, navigating our customers through. But what was more, I think I was excited to see in that time was my family's response to it, because they didn't have an awareness of it. From my daughter, who commented how she continuously saw hand sanitizing stations throughout her travel in the airport, just a step away. And so even coming through the TSA, she could immediately, after clearing the security lines, have a squirt in her hand and wipe her hand, or coming off of an escalator, wipe her hands again with rubber hands with the cleaning fluid. She felt good about that. And then my husband's comments were on seeing the Delta team feeling that they were comfortable and confident in the airport space, navigating just as they had prior to the pandemic, but then also wiping down counters and areas. He also commented on the spacing, the signage that we had available. It made him feel comfortable to know. It frequently friendly reminded him to give space to others around, but also give that reminder to others to give him space. And that was, those types of things reassured me that we are approaching this the right way. Travel was stressful in the best of times. And now since COVID, I'm sure it can be stressful for those who aren't doing it frequently. Our efforts to reduce the travel, to reduce the stress associated with the travel started well before the pandemic, and we've continued that effort to reduce the stress on every part of the customer's journey, now turning to clean and adding that piece in there. So ensuring customers know what to expect when they come to the airport is really important. We see the benefit of all the activity, as Bill said, in our NPS scores, where our loyal customers are saying they would recommend Delta. We've got record numbers in this, into the 75%. And so I think if I look at that, if I look at how our customers are responding in communications to Delta, we're doing something right. But the most important thing is the response from our team. They are comfortable in the work environment. They are committed to ensuring that the experience for our customers is warm, it's welcoming, and that our customers feel confident, such that when they're ready to fly during this holiday time, Delta's here.
Sandy, I think a lot of people who haven't flown yet, it's actually really nice. I mean, even going through TSA, I haven't seen a TSA line in the 6 months that I've been traveling this year. And I think, we're seeing in the TSA numbers more and more people are traveling every week. So I think as people get out there and realize the reality of travel these days, it's less people, more orderly people. There's a little bit more humanity in travel. And I'll just note that, Delta's partnership with Clear, I just flew through Delta at LaGuardia, beautiful new terminal last week, and you can now use your irises to get through security quickly. You don't even have to take your mask down, which is pretty cool. The whole
Yes, if you
touchless
add the
experience.
Delta app, the mobile app with that, you can have a touchless experience in all elements of the travel between Clear and the Delta app fly out.
Great. We've got a great panel here today. I want to get into some of our experts, but Bill, can you just explain to us the Delta Care Standard, your panel of these esteemed doctors and industry partners? Can you tell us a little bit about how that came together really quickly, and how important is that going forward, even post-COVID?
So I would start by saying we didn't think Delta Care Standard on day one of the pandemic. We thought about cleanliness, sanitization, spacing, personal protective equipment. But as we started to develop these relationships with some of the partners that we have here, it became very clear to us that we were designing something that we believe is very unique. Whether it is that we are electrostatically spraying every airplane before flight, to blocking the middle seat, to all of the PPE and social distancing work that we have throughout the airport, we were designing something differently. So the Delta Care Standard is all about the collection of elements that we have put together over the last 7 months with input from our partners, whether it's Mayo Clinic, it's RB, it's Gojo or Purell, or it's Emory or other partners. It's the collection of all of these elements to build the most confident, clean, safe travel experience that we can for our customers. And so we did want to engage with partners who are expert in this space, because we aren't. We're experts at flying airplanes. We're very, very good at flying a very reliable, customer-friendly operation, but we needed help from some of these experts, not only on what products should we choose, what processes should we reevaluate, but also how should we engage with our employee base on testing? And this is really where the Mayo Clinic has been very vital to us, helping us develop our baseline and retest program strategy for our employees. I don't know of another organization the size of Delta that has its employee base into a COVID testing program, and all of this being designed with the support from the Mayo Clinic.
Delta employees, or any frontline employees watching today, I just want to say thank you. During a pandemic, trying times like these, to be on the front lines and helping consumers who are understandably probably a little bit more stressed out. I just have to say, all of the Delta employees that I've come in contact with have been absolutely phenomenal. But I want to ask you, Dr. Ting, from the Mayo Clinic, I understand you're helping a lot with this employee testing program. And not only does that help keep employees safe, but that also helps keep travelers safe as well. Can you tell us a little bit more about this program?
Yeah, thank you, Brian. And I'd like to join you in thanking Bill, the Delta leadership, and the Delta employees on their significant work to enhance the safety of air travel. In our work with Delta, the Mayo Clinic and Delta formed a joint medical advisory council. And we've learned that Delta is actually committed to putting the needs of their customers and employees first. These are values we actually share at Mayo Clinic. What we're focused on in our advisory council work is to decrease the risk and enhance the safety of air travel. So specifically, some examples include we've started a testing program, baseline testing of all Delta employees with both PCR and antibody to determine the current and past infection status of the Delta employees. But furthermore, we've implemented a repeat testing protocol to proactively identify individuals who are potentially asymptomatic but may be infectious to others. This risk model to guide the repeat testing includes and incorporates an employee's work profile. For example, are they customer facing or in a corporate office? The community risk of infection, both current and future risk of infection, and the baseline testing results we've already obtained. We provided a very comprehensive review of all of Delta's health and safety protocols and policies and provided detailed recommendations. We provide a regular newsletter highlighting the recent advances in COVID trends, testing, treatments, and vaccines. And we joined a daily huddle with Delta and Mayo Clinic to discuss new projects and new opportunities for partnership. And I'd like to share a new and exciting project we're currently working on is the ability to test passengers with a rapid point of care test before they board a flight.
Yeah, Dr. Ting, let's talk a little bit more about that from a consumer perspective. So I've been able to travel to Croatia in August, and I had to get a negative nasal PCR test within 48 hours of arrival, giving me a tiny sliver to get that actually returned. And luckily, NYU Langone in New York is able to turn around those nasal tests quickly. I was in French Polynesia. They require one within 72 hours of departure, which gives you a little bit more time. But with so many tests taking 7 days or longer, I know a lot of travelers are nervous. Do I book a flight? And then what if I can't get that test? Now, you mentioned the rapid test, and actually just this week, London Heathrow Airport is trying to roll out a rapid test so that everyone can get tested before getting on a plane. But is that test accurate enough? I know from the early days, there was a lot of questions about the reliability of such a test.
Yeah, that's a great question, Brian. And in our work with Delta Airlines and Bill and his team, we're focused on rapid point-of-care tests that can give you result in 15 to 20 minutes, so pre-boarding process that are very accurate. We are seeing now innovations and advances in testing and supplies that may be available. And these tests would have a false negative rate, which is the most important number, of 1% or less. So that would give us a lot of assurance and confidence that no one who is affected with the virus is actually getting on the plane.
Got it. I think that would be really critical in opening up international travel, because right now, having 2-week-long quarantines to go to a country is not realistic for 99.9% of people. Bill, onto passenger testing. Now, there have been some airlines, especially around the reopening of Hawaii and teaming up with Hawaii testing, that are now including testing as part of the travel experience. What are Delta's plans to offer reliable COVID testing as part of the ticketing process? Is that going to be something we can see in the add-on flow to a Delta.com purchase?
Well, I hope that is the case, Brian. And we are, as Henry mentioned, we are working very closely with the Mayo Clinic, particularly as it pertains to international travel, because we understand all of the travel restrictions and the quarantine requirements when customers traverse over the ocean or north and south from here in the U.S., and how that can frustrate them, how it can be confusing, and therefore how it is really dampening demand. So we are engaged in a very detailed effort. We have a team here at Delta working with our partners. Mayo and others are involved, and it is around designing what we consider to be a very effective and very appropriate testing process, with the goal that if anyone does take the test and gets on a Delta airplane, they would arrive at their destination without any quarantine requirements. We've got some logistics to work through. There are some challenges. We're working very closely with the CDC on this as well. So and many foreign governments, as we're trying to identify the market, the timing, and the process for making this happen. But we do see that as a logical next step in ultimately stimulating demand internationally, and that is providing some level of testing that gives confidence that we aren't going to be transporting the virus in either direction, working with governments on both ends to make that happen, prototyping it, and then hopefully scaling that out.
I look forward to that. I've heard that express spas are going to be repurposing into express testing facilities, which is fascinating to me. So look forward to hearing more about that. Now, I want to get onto the actual flight experience. Pre-COVID, there was always a certain amount of people that I would see on planes wiping down seats and seat backs, and admittedly, I'm not one of those people. Did I judge them? No, but I think there was always like, oh, look at that person. But nowadays, everyone is, we've been told by the CDC guidance to really take that cleanliness into our own hands, even if the airline is doing electrostatic spraying. So I think, Joe, let's talk about, you're teaming up with Delta to help with onboard cleanliness. For any consumers watching today, what do we really need to do? What are the high touch areas that we should be focusing on?
You're going to walk on, you're going to sit down, you're going to touch the armrest, put on your seat belt, maybe adjust the air intake, the air conditioning. These are all high touch areas. You touch them, and if you're touching them, other people have touched them. So these become the hot spots that need to be cleaned and disinfected regularly. And they're getting done with every flight. Once passengers exit the flight, new ones come in. Before that happens, all these surfaces are being done. When you're on the plane and you are using the tray needs to be wiped down, and it is the little toggle that unloosens the tray. It's something that's touched regularly. Again, that is cleaned and disinfected also. And we're not losing sight of the bathrooms. A lot of people go in there, cleaning and disinfection in the bathrooms, and those same hot spots that people touch frequently are also being cleaned and disinfected with Lysol.
And talk about Lysol. So it's, COVID is clearly a concern, but there's a ton of other germs that we should probably be worried about as well. Using Lysol products, what is the consumer confidence there that most of those dangerous germs are actually being killed?
Well, that's a good question, Brian. To have confidence in these products, they all work. Right? These are regulated by the Environmental Protection Agency. The EPA requires that we do the testing following very stringent protocols against whatever microorganism or virus that we say we are effective against in killing or inactivating. So the actual testing has to be done under very controlled laboratory settings. The data that's generated is submitted to EPA. They review it to make sure it meets their standards, very high standards, by the way. And once they agree that it meets the standard that they've set and the product works, then we're allowed to make the claim on the product or actually sell the product if it's a good product.
God, it makes a lot of sense. All right, I want to switch gears a little bit towards the flying experience. Now, I'm constantly hungry. I'm not a pleasant person when I'm hangry. And if anyone's watching this, I would highly recommend, if you're traveling these days, even though airports, more people are traveling, restaurants and shops are, may be closed. So I would highly recommend eat before you leave your home, bring snacks with you. But let's talk about on the plane. So, you have to wear a mask on planes, but what if you need to drink or eat? Clearly, to do so, you have to pull your mask down, which then would create risk. So Dr. Ting, can you talk us a little bit? I know the Mayo Clinic did a simulation recently, and there are a lot of different scientific studies about eating on planes. When will we be able to eat fully on planes, or is it even safe for 10 seconds to bring your mask down to get a drink or eat a snack?
Yeah, thanks, Brian. So we had a Mayo Clinic team that included physicians, engineers, and researchers join Delta in a full flight simulation, which included food and beverage service. These guys all have an eagle eye towards enhancing the customer experience, while at the same time prioritizing safety, right? Because both are necessary. The teams working together developed two guiding principles, and I think you named one, which is minimizing the risk to customers, which is the amount of time they have the mask off for food and beverage or other needs. And number two, minimizing the risk to the Delta flight crew, which is the time it actually takes to complete the meal service from delivery to pickup. So, nothing replaces actually going to the site and seeing the simulation with catering service, the flight crew, the engineers. And some specific recommendations we made in order to get to sort of meal service again is number one, including the pre-flight meal ordering through an app. So we minimize a lot of conversations between the flight crew and passengers, which are aerosol generating activities during the flight. Another one would be consolidating the pre-meal beverage, which we all enjoy, with the meal service. So it's a single delivery. Expanding the already pre-packaging of snacks and water bottles so they can be handed out quickly. And then as the customer or the passenger, thinking about staggering the time you have the mask off to drink and eat with your neighbors, right? So to minimize the amount of time that a mask may be off with two people who are in close proximity. So are owning that and are staggering that process ourselves as passengers. Our teams continue these ongoing discussions and simulations, and will continue to do more of them, again, to enhance the customer experience while maintaining safety.
Dr. Arbogast, yes, between washing your hands and sanitizing, do you need to do both? Is Purell sufficient on its own, or what's the best practice for travelers to keep as safe as possible while traveling?
Well, I would say that both hand washing and alcohol-based hand sanitizers are effective solutions. We know with Purell, with a lot of science and testing into proving that all of our Purell products are safe, effective, and good for you. When you're cleaning your hands is really the most important thing. So when you clean your hands, whether it's hand washing or using that Purell hand sanitizer, good examples in the passenger journey would be after they've seated themselves and settled into their seat, maybe cleaned up their environment, pulled out their ear pods, etc. It's a good time to clean your hands. After using the bathroom, of course, and then probably most importantly, right before eating.
Just so for anyone watching, you actually get Purell packets now on Delta, which I make sure to use, not just on my hands. I don't know if you know the answer to this, but is it cool to put Purell on an iPhone? Because I know that surface gets pretty dirty as well.
Well, we're not supposed to do that. As Joe mentioned earlier, the surface products are regulated by the EPA. Hand sanitizers and any personal care products like soap are FDA. I did want to mention that we've worked really hard with the Delta team to provide a variety of solutions throughout the passenger journey. As Sandy mentioned, on the way to the gate and at the gate, you'll find a Purell dispenser. Personal use products like this Purell product here are being provided in customer care kits by Delta. Wipes are being provided with the meals. And then really excited that we innovated with Delta and brought the first foaming alcohol-based hand sanitizer to an airline. That's going to be right outside, anchored to the wall outside the laboratory. That's great for customers if they're up and moving about, and definitely great for the Delta employees, the crew that worked so hard on those flights.
Got it. So note to self, don't use Purell on my iPhone going far further. Thanks for clarifying that for me. All right, we're starting to run out of time, so we want to make sure we have time for questions. I've got my phone here. The Delta team is texting me your questions, so please make sure to submit, and we'll try to get to them. Now, I want to turn on to a hot topic, which is masks. They are mandatory on board. Delta was probably one of the first out of the gates to not just say you should wear them, but you have to wear them, and it's not really an option if you don't want to, as passengers will get banned from the airline if they don't comply. Now, I want to, Dr. Del Rio, just talking about masks, the safety of masks. I know some passengers are wearing face masks as well. Can you talk to us? Should you be wearing both throughout the whole flight, or what are your recommendations there to be as safe as possible?
So, Brian, face mask, face covering is probably one of the most important things we can do. When we try to do safety, when we think about safety, there's so many things that are happening. The air circulation, the HEPA filters, the cleaning of the plane, the hand sanitizing, all the things we talked about. And what we need to do is have several layers of security at different levels in order to minimize transmission of the virus. And having a face mask is a key component of that. So having Delta require a face mask of all their passengers and their crew throughout their flight is very important. It's very important, though, that people know how to use a face mask, because you frequently will have people wearing the face mask but not covering their nose. And that's wrong. You need to cover your nose. But the other thing is, I particularly find that throughout the flight is totally safe just with your face mask, but the air circulation is happening. But there are 2 points that I worry a little bit about. One is during boarding, and one is during onboarding at the plane, because the plane is parked, there's not a lot of circulation, and passengers are moving, and if I'm sitting down, somebody could potentially, cough or sneeze or something, not wear their mask appropriately. So for those reasons, for the boarding and the onboarding, I also like to have either goggles that I wear, or I will wear a face shield, So I'll have a face shield in addition to my mask, which I'll take off after the flight. So I think, little props like that, things that protect me. And at the end of the day, what's protecting me is also protecting the other customers. So we need to also get everybody to understand that if we all wear a mask, if the entire flight wears a mask throughout the process, if the crew wears a mask, we're all going to be protected. And the risk of transmission during a flight, we know from a recent study, is incredibly low. It's probably less than 1% chance of getting infected if we do things the right way.
And Dr. Del Rio, I have to say, some people have criticized Delta saying, well, a blocked middle seat still isn't the full 6 feet that the CDC recommends. therefore it's not effective. Can you talk just a little bit about, does blocking middle seats actually matter? And going forward, once that policy is no longer in effect, as Bill mentioned, would eventually happen, is it still safe to sit next to someone?
Well, blocking middle seats is a very important strategy right now because, again, it's decreasing the number of people on the plane. You're really decreasing the number of people on the plane by 1/3, and just simply decreasing crowding in a closed environment is a very important strategy. Hopefully in January, the epidemic will start to come down. Maybe by then we'll start having vaccines. So it'll be a different ballgame. We would even need to talk about, are we going to be requiring people to be vaccinated to get on a flight? Is that going to be important? But even if you don't decrease the number of people by not blocking the middle seat at that point, continuing wearing a mask is going to be critically important. And again, increasing the safety. I'm somebody who likes to travel. I have to travel frequently for my work. And like you, I have done it. I have done it safely. I test myself frequently to make sure that I'm not infected. But it is all about having hand sanitizers, having your Purell bottle with you, having your mask, wearing appropriately, making sure that others are doing the same. But I want to stress to people that it is safe to fly right now. Delta has done everything possible, working with airports, working with customer service to ensure that the flight experience is not only adequate, but most importantly, safety. Passenger and safety first is the number one thing that Delta is pursuing, and I think we're really happy to work with them to achieve that.
Great. Just this week, actually on Sunday, over 1 million TSA passengers were screened, which was the first time since March that number hit. That's up from as low as 80,000 in April. Sandy, I want to ask you, you're all about the airport experience. For people watching who may now finally feel confident enough to travel this holiday season, more and more people will inevitably be in the airports. What is Delta doing to prepare for this busy travel season?
Yes, Brian, thanks. I think the best thing I can tell you is we've learned there's not one silver bullet to ensuring that all of our customers feel comfortable in flying Delta. So we've taken a layered approach. And from the mask wearing requirement that we were just speaking of, to the electrostatic spraying that Bill mentioned that takes place before every flight, every day, which is then followed by a wipe down of all the surfaces with that same high-grade disinfecting solution. That, coupled with us also using that same approach inside of our airports and our sky clubs, adds another layer of protection and comfort for our people and assurance for our customers that it's safe to travel. In addition to that, as I shared earlier, we have all kinds of signage available in the airport to remind customers to provide space, including seat markers that allow for there to be space between customers when seating in the gatehouse, so that you also have that space there, along with the blocking of the middle seat on board the airplane. Ultimately, all of these pieces come together in addition to ensuring that our customers know what to expect when they come to the airport. Through our check-in process, we now have a series of 3 questions that we ask customers that also not only allow them to self-disclose that they meet all of the requirements outlined by the CDC to fly, but also committing to adhering to the requirements we have in place to keep our employees safe and to keep our customers safe. So all of these things together, we are confident should bring a level of confidence to our customers who want to travel this holiday season, that it's safe to do so with Delta. We've put all of these in place, and then we've wrapped them tight with the wonderful Delta team who's there and responsive to any of our customer needs, and our customers only need to reach out to them and they'll be ready to support them.
Excellent. All right, I want to end the panel portion. We're going to get into Q&A in just a minute, but I want everyone, if you want to say one tip or one thing that you might have missed earlier that you want consumers to know. I'm going to start it off real quick and just say the TSA now allows you to bring up to 12 ounces of hand sanitizer through the TSA checkpoints, which I found was pretty interesting. All right, Dr. Jim Arbogast, any tips from you?
Thanks for that. I would say that the formulation really counts. Not all hand sanitizers and hand soaps perform the same. And with the Purell formulations, we make sure they're good for your skin. They're great at removing or killing those germs that may get you sick. And they provide a good experience even if you use them multiple times in your trip or in a hospital system. My last point is these are the same great solutions and formulations that we provide to hospitals throughout the world, really, and in the U.S. that includes the Mayo Clinic and Emory.
Great. Dr. Carlos Del Rio, any final tips?
My final tip is following with what previously was said, is in healthcare we have instituted universal masking, and by having universal masking we have decreased the risk of infection to our patients and to our staff to almost zero by doing that. So universal masking during the trip is critically important, and I want to tell you as a passenger that you have to wear your mask. It's for your safety, it's for the safety of others. So please help us make sure that everybody, including the flight attendants and your fellow passengers, everybody in your family is masked appropriately. There are masks available on the gate. If you don't have one, we'll get you one.
All right, we are going to just get into audience questions because there are so many good ones. And Bill, the first one's for you. So what is Delta doing to bring back food and beverage, those delicious hot meals that we miss, onto the plane? What's the plan there?
Well, I'm glad to hear that you all miss the delicious food that we serve on board the airplane, but I will tell you that likely you won't see much change in the in-flight service between now and the end of the year. As Dr. Ting indicated, and Dr. Del Rio just made some comment around, masking is very important, minimizing touch points is very important, and as we see the infection rates going up in many parts of the country and the world, we are of the mind that your safety is far more important than the food that we would serve you. So we're evaluating how we will ultimately step back into expanding the in-flight food and beverage service. But for the time being, between now and the end of the year, we're going to play it very safe and make sure that we are minimizing those touch points and the opportunity to lower the mask. So expansion of the service sometime first half of next year is my guess.
Great. All right, next one's from Daryl on Facebook, and I'm going to pass this one to Sandy. What safety precautions does Delta take in the Delta Sky Clubs?
Oh, that's a great question, Daryl. And so our Sky Clubs, we've revamped our Sky Clubs to offer the same wonderful food and beverage amenities, but in a safe packaging, individual serve item. We've also reintroduced some hot items in our Sky Clubs, and those are being provided to our customers with by a barista or a person behind the counter waiting to serve you. So the buffet approach has been eliminated. We also have spacing for seating available, and we have specially designated areas for family and group seating. So it's a really welcoming environment.
Great. And this one's from David on Facebook. I'm going to pass it to Bill. So can you outline the clearance to fly process? My 19-year-old has significant cognitive impairments and will not keep a mask on for the duration of the flight. We're booked to fly over Christmas week. Thank you for continuing to keep the middle seats blocked. But can you just explain the process of who can be exempt from wearing a mask?
So we do require all of our customers to wear masks on board unless they have received a medical exemption, and that medical exemption can be obtained when you are at the airport. If you contact a Delta agent, they will make contact with the University of Pittsburgh Medical Center. We refer to them as StatMD, and there will be some questions that will be asked, an evaluation will take place, and a determination about whether or not a mask can be left off in that particular case will be made. But it's a very limited number who we will allow to get on board without a mask, and all of those are cleared through the University of Pittsburgh Medical Center.
And Bill, one more from Karen on Facebook. How do you make sure people actually wear masks on board and enforce the rules?
Well, our customers will not be able to board an airplane. They will not be allowed to board an airplane if they are not properly wearing a mask when they go by the gate agent. Now, we understand that once they get on board, there's the opportunity to pull the mask down. And we've asked our flight attendants, and they've been doing a tremendous job in this regard. We've asked our flight attendants to be on alert. We have other passengers who will advise the flight attendants that somebody is not wearing their mask or not wearing it properly. And with their typical warm, genuine interaction and service, our flight attendants will address that issue with the customer. If the customer is not willing to put the mask on appropriately, we will give them a final notice and let them know that they aren't going to be allowed to fly Delta again if they don't. And in 460 cases to date, we've put customers on the no-fly list because they were not willing to put their mask on properly. So we do have flight attendants and agents who are keeping an eye out for this and engaging and doing what they can to convince customers to appropriately mask.
That makes sense. Next one is going to be for Dr. Arbogast. This comes from Robin and also me. Isn't too much hand sanitizer bad for you?
That's a common myth that we hear about. There's many myths and misunderstanding in hand hygiene, and too much hand sanitizer, too much hand washing is not bad for you. Healthcare personnel that care for patients, they clean their hands literally hundreds of times per day. There's no evidence to suggest that hand hygiene or surface hygiene causes any harm. I think this sometimes gets mixed up with antibiotic resistance, which is a completely different issue. The other big myth, since I have the mic, I'll say, is that hand sanitizers do not dry out your skin. If they're formulated well, like Purell, they will not dry out your skin, and in fact, are usually milder than hand washing.
The more you know. All right, these are great questions, everyone. Please keep them coming. I'm really enjoying this. The next one, I'm going to pass this one off to Dr. Del Rio. This is from Dewey on Facebook. Do you recommend a COVID test before leaving for a trip or returning from the trip?
That's a really good question. Testing is a good strategy. And if you're going certain places, for example, Hawaii, when you went to Croatia, Brian, I think getting a test, and if you can get a test within, a result back within 24 hours, get tested the day before you take a trip. In fact, I did that last time when I traveled to New York and make sure I got a test 24 hours before. But then, after I come back, I wait about 4 or 5 days and get another test. And again, when I'm there, I'm masking, I'm doing all those things, but you are exposing yourself a little more. And because of my age, because of the job I do, because I take care of patients, I want to be sure that I'm not infected. So I go and get another test. And, so far through this pandemic, I've been tested 7 times and continue to be negative. So again, I'm doing the right things. I'm using my PPE, I'm using my mask, I'm using my face shield, and I'm keeping myself uninfected.
And Dr. Del Rio, in the beginning of this pandemic, testing was very limited. When I started to get tested when I traveled, people would say, you're taking those tests away from people who need them. Can you speak to the state of testing in the US today? And is it really is it selfish for us to get tested for travel?
I think, Brian, that at the beginning, you're absolutely right. We just did not have enough tests. But right now, our country is doing about 1 million tests per day. And that's a lot of testing. And there's plenty of testing capacity in most cities. When I look around, there's plenty of testing capacity. The return time is not yet ideal. In some places, it's 72 hours. We would like to see it faster, 24 to 48 hours. But in many places, it's 24 to 48 hours. Also, as it was previously said by Dr. Tang, the testing technology has evolved dramatically, and a lot of new rapid tests are coming to the market. The government just bought from Abbott a big supply of the Binax Now test. The Binax Now test is a fantastic test that they're going to be giving out to the states to roll out for schools and other institutions to keep them safe. So I think testing is a good strategy, and if you can get a test before you travel and after you return.
Good advice. All right, the next one's from Terry on Facebook. I've read about the great job Delta's doing with the planes, but our fear has been bigger airports, such as LaGuardia. We live in a medium-sized city, and we're not too worried locally. What about the bigger cities and the jetways?
Yeah, I'll take that one, Brian. I think the same applies whether it's a large airport or a medium-sized airport or a small airport. We have appropriately put in many of the precautions, including plexiglass dividers. So when you're interfacing with our team members at a counter space, there is the clear divider that allows you to have that protection there. And then specific to the question around jetways, inside of our jetways, we have signage that, again, reminds our customers to keep space between them as they're about to board or onto the airplanes. But our agents are also taking those extra steps to provide spacing between our customers as they are going into the jetway to ensure that we don't have the long lines and the backup in those jetways. In addition to that, we're very focused on the air quality on the plane with the use of recirculating of air every 2 to 6 minutes, either with a combination of fresh outside air or with our HEPA filters, our high industrial grade HEPA filters, but we're also being focused with that as it relates to the jet bridges and our gatehouses, wiping down surfaces. So I think the same comfort that you have in a small airport, I would feel in a large airport.
Sandy, just because I have you, Glenn on Facebook asks, is a face shield allowed in place of a face mask?
So a face shield is not allowed in place of a face mask. You, as Dr. Del Rio said, you can absolutely have it when you're boarding, or if it just gives you an extra layer of comfort to have that protection. But the face mask is what all of the medical community and the scientific experts are stating is the single most important element of all to stop the transmission of the virus, and it is what Delta has signed up for. And I will state that in addition to the many customers that are adhering to those requirements, as Bill shared, all of our employees equally adopted very quickly to the requirement to have the face mask and do that, which gives them comfort that they are protecting each other and our customers as you all come through the airports.
Great. Bill, this one's for you. So Jody on Facebook asked, what are the risks on regional jets? Are they safe? And all of her flights require her to connect on a regional jet. They don't have middle seats, so are seats still blocked?
That's a very good question. I appreciate that. Jody, I believe, was the name. Our regional partners have been with us all along. All of the safety protocols that we are putting in place from a cleaning and a PPE perspective apply to regionals as they do our mainline. Yes, the middle seat blocking is a challenge on regionals because you don't have a middle seat when it's two on each side. But we have selectively gone in and blocked seats from being booked on the regional flights so that we cap the capacity on those aircraft as well. So you should feel just as confident getting on board a regional aircraft as you do on a mainline aircraft. And while I've got the mic, just one more thing. Sandy gave you a great answer about small, medium, and large airports. One other thing that I want to mention to you is that we also have teamed with the TSA, with all of the airport leaders, and we've teamed with car rental facilities or agencies as well as hotels to share all of our best practices so that the entire travel ecosystem, we hope, gets elevated to the standard that we define as the Delta Care standard.
Bill, and while I have you, so Juan on Facebook asks, are all of the precautions that Delta has in the US, are they being implemented on international flights as well?
International and domestic flights get the same precautions, and much like I just mentioned with our regional partners, our international partners as well. We've been sharing best practices. In fact, we've learned some from them that we have deployed here in the US. So yes, you should see, to the extent possible, you should see a very consistent experience, domestic, international, Delta to any of our partners.
Great. The next one, I'm going to pass it back to Dr. Del Rio. So what is the best source of information to learn about safe travel and all of these constantly changing travel restrictions? Any sources that you recommend?
Yeah, there are plenty of sources. I personally like going to the CDC website. The CDC website has very good information. Also, the Infectious Disease Society of America has a very good information on COVID. And there's, writers for the New York Times and Watch the Post that dedicate themselves to write about travel. And of course, go to the Points Guy. The Points Guy has great information about travel and what new is there and what needs to be known. So I think, looking at the updated information is very important. The other thing is important to just look at the epidemiology at the site you're going to go to. See what's happening at that local site. See what's happening there. Because I think, it's just as important to know is now instead of looking at the weather, I look at the weather, but I also look at the COVID situation, that specific city I'm flying to.
Yeah, I think that makes a lot of sense. I've also been using Google Flights, has been good about, they also help pull in a lot of different data from different sources. But, it's still a manual effort to kind of do that research, but I appreciate the call out to the Points Guy as well. Bill, we've got to wrap it up here. Now, I've flown all different airlines internationally and domestically during the pandemic. I've personally experienced the difference that each airline has. How would you describe how Delta is different flying today in October of 2020 versus, the big competitors, the other choices that you have, when flying specifically in the US?
Yeah. Well, certainly our competitors could use the same products and run the same processes, but I would say there are a couple of things that really differentiate the experience on Delta. One is the care that our people deliver every day, every minute. There is not a better team of airline professionals in the world. I would put them up against anyone. That's the first thing. Second thing is we've talked about the blocking of the middle seat. There are going to be very few carriers. In fact, come January, only one carrier will be blocking middle seats that I'm aware of at the moment. We've made our commitment to the 6th of January, and we'll evaluate at that time. The fact that we are electrostatically spraying before every flight. I don't believe there's another carrier on the planet that is doing that, of our size anyway, that is electrostatically spraying. And here for me is kind of the real kicker. For us this is not a one and done thing. There is no finish line to our cleanliness efforts. We have changed our mindset about this. This is why we're partnered with all these great partners that you see here on the panel, is we want to understand how we can innovate and continue to push the envelope on cleaning. So we've built an organization led by an officer of Delta Airlines called the Global Cleanliness Organization that is all around what do we do not only through COVID, but beyond COVID to continue to push the experience in our facilities and on board our aircraft, not only for our customers, but for our employees. So there's no finish line for us to cleanliness. So I think that's the way we differentiate ourselves.
Absolutely. And, thank you to our entire panel today. When I was asked to do this, I immediately said absolutely, because I think it's critical. The travel industry supports millions and millions of jobs around the world. It lifts people out of poverty. I'm a big believer in the more we travel, the better people we become. And I think the more people are educated from respected doctors, know the science behind travel and how to be safe, I'm confident that we will get to a place where people are traveling again. But of course, we always recommend talk to your own physicians, make your own personal risk assessment. But I do want to give Delta kudos. I'm the points guy. I love my frequent flyer miles and elite status, and Delta was the first to come out of the gates to extend loyalty through next year, since 2020 has been quite a doozy, and most people won't be able to fly to retain their status. So the innovation there in loyalty, and I just want to say to people, you can now book flights because of wave change fees on most domestic flights, especially starting in 2021. You can book with confidence. If it comes time to fly, you're not feeling well, you don't feel comfortable, you can always change without a change fee now on most fares, and wait till later when you're more comfortable with travel. But certainly I'm just here to help the entire travel industry rebound and educate consumers on how to do it safely. And we wouldn't be able to do that with everyone here today. So just want to say thank you to everyone for logging on today, for submitting your awesome questions. And please stay safe and see you in the air.